Hey guys, it's Dr. Justin Marcagiani. Welcome to the Beyond Wellness Radio podcast. Feel free and head over to justinhealth.com. We have all of our podcast transcriptions there, as well as video series on different health topics ranging from thyroid, hormones, ketogenic diets, and gluten. While you're there, you can also schedule a consult with myself, Dr. J, and or our colleagues and staff to help dive into any pressing health issues you really want to get to the root cause on. Again, if you enjoy the podcast, feel free and share the information with friends or family, and enjoy the show. And we are live. Dr. J here in the house. Evan Brand here as well. We are excited to talk to you guys about the gut-histamine connection. This is a common question that we get a lot while in the trenches daily with our patients. Really excited to dive in. Evan, what's going on, man? It's been a hot minute. How you been?
Yeah, I've been really well. And this issue, I don't know if it's because you and I are recognizing it more or if it's just because it's more common. Maybe it's a combination of both. But, I see so many issues where people start out with a digestive problem. Like they'll complain about stomach pain or cramping or diarrhea or constipation, maybe some skin issues, maybe some mood issues, anxiety, depression, fatigue. And then all of a sudden, histamine comes into the equation and people start realizing, wow, I'm actually allergic or I'm having these sensitivities to histamine-rich foods, like maybe avocado. That was a big one for me. I would eat avocado, I'd get a headache from it. Then I learned about histamines. And sure enough, when I went low histamine, a lot of my symptoms resolved. So I think this is an important piece of the puzzle, especially depending on when people are listening. Things are starting to bud and bloom. And so people may be reacting to outdoor allergens, pollutants, pollen, et cetera, things blooming. I think it's because their bucket is already so full because of gut and the histamine producing bacteria that now they're reacting to the outdoor environment. So people go to the ENT, they jump on the allergy med, but that's not necessarily the root cause solution.
100%. I see it all the time where, you get patients that go to, the conventional doctor, like, oh, I have mast cells. And then they're just basically managing that patient with a lot of fancy antihistamines, different things like that to kind of decrease the ability to either make histamine or help your body kind of degranulate it or break it down. And they're like, well, this is what I have. And they're so focused on the actual diagnosis, like the diagnosis is its own entity. Where the diagnosis, I always tell patients, is just a manifestation of a lot of upstream issues working their way down. And so it's kind of like you have all these systems that are out of whack, whether it's gut bacteria. And we know, for instance, that there's different bacteria when overgrown can drive histamine. You were mentioning that. Morganella, Klebsiella, Pseudomonas, Citrobacter, Proteus. These are all bacteria that are common like in SIBO and just in general dysbiosis, that these bugs can actually produce a lot of the histamine. And then, of course, if your gut's inflamed, you're eating lots of processed flours, acellular carbohydrates. That's going to feed a lot of these things. And then, God forbid, you come in there and you have some antibiotics over the course of your lifetime, maybe more than you should. Now you have this perfect storm of like processed foods. You have antibiotics. Maybe you come in there and you have a lot of glyphosate and Roundup exposure, and now that whacks out your brush border. That creates rebound overgrowth as well. Maybe you have some mold exposure. Now you're overly stressed. You have low stomach acid, low enzymes, low bile salt. So you can see how this storm isn't just like this, oh, I just have a Zyrtec or an Allegra or a Pepcid AC deficiency. It's like, no. That may help you palliatively control some of the histamine symptoms, right? Brain fog, dizziness, vertigo, obviously like urticaria, hives, skin stuff. It may control some of that fatigue, but it's not going to fix it. And so you always want to go upstream to the root.
Yeah. And this is not a sexy idea because it's not one silver magic bullet that you and I can offer. We have to tease it apart and go, okay, well, over here we have on your stool test, for example, we see 5-6 different bacteria all producing histamine. We see here you have an older home. You don't have any air purification in the home, so there may be indoor pollutants kind of creating a mast cell reaction. Then you may have tick-borne infections. That I always factor that in just with my own personal suffering. Lyme, Bartonella, Babesia, these things also drive histamine and mast cell activation. Mold, mycotoxins, those drive it. You mentioned glyphosate, other chemical exposures. I would assume heavy metals are probably aggravating the mast cells and creating a histamine response as well. So when you tell someone, hey, get rid of the Zyrtec. Let's do this, that, and that. It's a little bit harder of a sell, but I would encourage you guys to just take things one at a time. And if you're working with someone like Dr. J or myself, we're going to help you to align the puzzle pieces in a way that's going to slowly get you better without getting you worse. Because the problem is, we'll see people that go do rifaximin, and this is their naturopath or some supposedly integrative medical doctor that went functional, and they'll go put them on rifaximin or something else for the SIBO, and they flare up worse. Or maybe they get relief for a month or two, and then they call us. Hey, I've already been to 5-6 people. Can you help? And usually we can. We like the high pressure environments.
Yeah, 100%. And so I always try to be the most conservative as possible, try to use more herbals and get to the root first. Obviously, like the first thing is if you're coming in and you're super inflamed, you're overly sensitive to histamine, and you're already on some medications, and those medications are they helping you, whether it's like an H1 receptor antagonist or an H2 antagonist or an H1 blocker, right? There's typically the H1 and H2 kind of antihistamine type of families, right? Whether it's, I think Allegra's one, I think Zyrtec's one, Pepcid-AC's one, I think Zyrtec's an H2 blocker, right? So there's different families of drugs that fit into those categories. There's obviously some more experimental drugs that are coming out down the pipeline. But these are just common ways that your conventional doctor may be managing it. I tell patients, hey, if you do that medication, how do you feel? Do you have an improvement? If you do, that tells me something, right? Because if your histamine bucket is full and those medications help, well, the root cause now is to pull out the antigens or the foreign material that's filling up that bucket. Now, in some people, I'm like, hey, what's your environment like? Do you have a bunch of seasonal allergies coming in and impacting your sinuses? Do you have mold in your home? Because the easiest thing out of the gate is get your air quality in the home clean and flush out your sinuses. Because a lot of times you're outside during the daytime, you're bringing all those weeds and pollens into your sinuses. You're bringing them in even though you're inside in a good environment. You got to get those things flushed out. So we'll do saline, we'll do xylitol or some biofilm busters, and we'll flush that stuff out once or twice a day. And we'll make sure the air in the home is super clean, and we'll rule out any mold issues or environmental issues in the home too.
Yep. They had a question come in about H. pylori. Can H. pylori cause histamine intolerance? My gut feeling was, yeah, I would throw it in the category of any of the gut bacterial overgrowth. Well, here's a paper on it right here from an Immunology Journal 2004, effects of Helicobacter pylori on gastric inflammation and local cytokine production. And long story short, it says here, results suggest H. pylori induces lower TNF alpha and interleukin 6 secretion in the mice. So this is a mice study. They're saying here that H. pylori produces considerable cytokine production in the infected groups. Now, they did something here. This is kind of interesting. I don't know how they do this. I guess they mess with the enzymes, the histidine decarboxylase in these mice. So that's interesting because they're kind of comparing like a regular mice versus this altered mice. And then they gave the mice H. pylori. And yeah, I mean, it's a piece of the puzzle, right? So I can't say if you just had H. pylori, would that create a histamine intolerance? But it's rare to see that by itself. Wouldn't you say? Most commonly, we're going to see candida or maybe some other bacterial overgrowth with the H. pylori.
Well, also too, if you have H. pylori, right, we don't have to go too far to kind of make it make sense just with the deductive reasoning, right? So we know H. pylori can decrease stomach acid, and we know low stomach acid impairs digestion. We also know stomach acid also has a mild antimicrobial effect. Right. This is the reason why people make, homemade topical cleaners out of like white wine or apple cider vinegar, because the acidity actually kills stuff. And so we know if we have good acidity levels in our gut, it's going to make it easier to keep the bug level down in our gut. We also know women that do birth control pills increase the vaginal pH, makes it more alkaline. That makes it easier for yeast to grow, right? We know these. So we can kind of use deductive reasoning and say, hey, if we impact the pH and raise it above where it should be, that can make it easier for bugs to grow. It's very possible.
Yeah. And, the person commented that they have H. pylori and histamine intolerance. They don't want to go to conventional doctors. What can you do to feel better? Well, number one would be get a full workup done. We'd like to look at stool and urine to figure out what all is happening. And then we come in with herbal antibiotics, and you can knock this thing out within a couple of months. Unless you have a spouse that's reinfecting you, then we may want to get them on board. But, between Dr. J and I mean, we've probably fixed thousands of cases of H. pylori. So the cool thing is with herbs, we don't appear to have the same antibiotic resistance that we see with the conventional drugs, because now they're moving on to quadruple therapy, which is 4 different antibiotics at the same time to treat this. So it's a real mess. And as you know, we've talked about before, as soon as you wipe out one thing, then other things are likely to move back in. So maybe you do clear H. pylori with triple or quadruple therapy. I have seen it be successful, but then we see all the other crap move in, the Klebsiella, the Citrobacter, C. diff, other types of Clostridia, those move in, and then those create other problems. So it's kind of like
Yes.
you played whack-a-mole, right? Like you knocked the one pathogen out, and now you've got these other histamine-producing bacteria that move in. So you're still in the trenches here.
100%. And so I look at it like this. Stomach acid is a really good and first important step. We need that. We know most people's stomach acid and bile acids drop. And bile acids, they're slightly acidic, but they can also prevent a lot of bugs from growing, right? So this is really important. People that have SIBO tend to have lower bile acids as well. And so one of the first things that we'll use to kind of stimulate motility and stimulate acid production, we'll use a bitter called ginger. And ginger is also a mild H2 blocker. So it can also help modulate histamine a little bit, which is really cool, while also stimulating digestion, which is really interesting. And people will use like an H2 blocker like Pepcid AC, but the problem is that drug actually will block hydrochloric acid levels, where some of the natural H2 blockers like ginger won't actually block it. It will actually stimulate it, which can be much better. This is why drugs have side effects. They tend to disrupt and block, inhibit enzyme pathways. So you tend to have more side effects, where herbs just tend to enhance and support.
Yeah, well said. And I was just going to throw in ginger too is always helpful when you have nausea, because a lot of these gut bugs can produce nausea. I told you years ago when I had H. pylori, not only did I have anxiety, but man, my nausea was out of control, especially on an empty stomach. It was awful. So I would just do these ginger chewables, and that would really help tamp it down.
Yeah, exactly. Now I tell patients, like, obviously lifestyle is a foundation, like the food you eat, diet, sleep, but if you're eating like really good, high quality grass-fed steak or salmon, but you're not able to break it down well, that's a problem. So that's why like foundational digestive support is going to be the foundation. It's almost equal that of with food, because if you can't break the food down, the food, even though it's healthy, can also be a stressor on your body. So I really want to get the HCl, get the enzymes dialed in. Now, some people, when their gut's really raw and they have a lot of histamine issues, they may not be able to handle much hydrochloric acid. And that's where working with a clinician, like some patients, they kind of jump to conclusions. They like try HCl, they have a negative reaction, like, no, it's not for me. And they kind of just jump ship. It's like, wait a minute, like utilize the thousands of patients that we have data points from and figure out, what does that mean? What's plan C? What's plan D? What's plan E? Because there's ways that we can either lower the dose, increase enzymes and bile acids, use bitters. There's other little tweaks that we can make to make that work. And then also, what does it tell you about your body? It tells you probably have atrophic gastritis. You probably have a really thinned out gut lining. And we really have to work on building up those enterocytes, building up those goblet cells, building back up those parietal cells, really that mucosal lining, really building it back up.
Yeah. And question came in about gastritis. Well, figure out what's causing it. Gastritis is just it's like the upper GI IBS. What I mean by that is, like, you go to the conventional doctor, if you get referred to the gastro with diarrhea, constipation, they'll throw the IBS label on you like they did to me years ago. If you have any kind of issues up north, say stomach or higher, then you may get this gastritis diagnosis. And often what's going to happen is they may throw in that acid blocker, reducing stomach acid further. Now your food's not digesting well. Now you're getting a buildup of these histamine-producing bacteria. Now you develop histamine intolerance, all because the doctor was trying to fix the gastritis and put you on the acid blocker. So he screwed up this whole, there's a negative domino effect that happens once the pharmaceutical is put in for gastritis. So our remedy would be to come in and say, number one, do a stool test. We would likely run the GI map. That's our favorite at the time of this recording. And with that stool test, we would look at calprotectin, which is your gut inflammation. We would look at pancreatic enzymes, look for H. pylori, look for all the bacteria, and then we would do it in the proper order. So maybe there are some soothing herbs, like you mentioned in the beginning, and then ultimately knocking the infection down that's causing gastritis. So you can't just glutamine your way out of this. You can't just chamomile tea your way out of this. Ultimately, there's something driving it. So I'm cool with the natural soothing remedies. You could drink a gallon of aloe juice a day if you want, but it won't clear the bugs. So really, you got to figure out what's driving it.
Yep, exactly. And so one of the big things I'll use Manuka honey because I find it can have a natural antihistamine benefit. It can reduce the body's production of histamine. Plus, it's very soothing. They use it in burn victim units in hospitals. It's also antibacterial. So if you have a higher level bacterial load in your gut, let's say H. pylori, it could probably start knocking it down a little bit. I would say I would never rely on Manuka honey to address H. pylori by itself, but it's a gentle way to start. Again, I don't like to come in there and throw heavy herbs out of the gate because I just find if someone's gut is raw and we throw a whole bunch of clove or mastic or oil of oregano or berberine, that can sometimes irritate an already sensitive gut lining. So we want to really work on getting everything dialed in the first month or two. And, how that food is cooked and prepared makes a big difference as well. So I like ginger. I like Manuka honey. Again, glutamine or glycine or collagen is a good building block. But like Evan said, if I throw a whole bunch of building block, let's say wood, into a burning building, does that really fix anything? It's like, no, we got to get the fire down, right? So yeah, here's this building block, but we got to get the fire down. And it's not bad to throw it in there, maybe with some aloe or some DGL or some ginger or some Manuka honey or something that's really anti-inflammatory and gentle. I have no problem with it, but you got to look at it, talk about it with your functional medicine doctor, have the big picture plan. Don't just go and throw stuff at it willy-nilly.
Yeah. And the truth is, when you're desperate and you're miserable, you're going to run somewhere and do something. So I would encourage people, if you are in the current state of suffering, you have histamine issues, you have gut issues, you're having this gut histamine problem happening, just either reach out ASAP to us so we can help tamp it down, or do something gentle and slow. Don't just go jump on 3, 4, 5 drugs. I've seen it. They get on cromolyn, and you named several other pharmaceuticals. They jump on those, and then now you have to clean up the issues with that. Now there's potential osteopenia or osteoporosis because they've been on acid blockers for 20 years, screwing up their mineral absorption. So now you have a bone density problem, or now there's a mobility problem because their hips are weak, right? So it's like there's other collateral damage that happens when you are incorrectly tamping down the acute situation of stomach burning, GI pain, gut issues of any kind, histamine problems. So I would encourage people, pace yourselves, but I don't want to talk people out of getting care. I'm not saying that. Like, if you need a colonoscopy because you're bleeding out of your butt, yeah, you got to figure it out. If you're vomiting blood, yeah, you got to figure it out ASAP. But if it's this subpathological issue, meaning there's no formal diagnosis you've been given, they just kind of brush you off and send you home with a couple over-the-counter remedies, then you really got to start digging. So get your stool looked at, get your urine looked at, and check out your partner too. Your partner could be a vector. So that's why I always ask the question, hey, you have these gut issues. Well, what about your spouse or your partner? Do they have the same issues? Yep, they sure do. What about your kids? Oh yeah, my kids' guts are messed up too. Okay. Then we find out this infection is whole family wide. So if we can, sometimes we're working on the whole family.
Yeah, 100%. And again, most diagnoses, really aren't that helpful. Like, let's say you have some inflammation in your stomach and you're like, I need to go to my doctor and get a diagnosis. So let's say they just look at symptoms and they say, okay, well, we're going to just try to give you an acid blocker because you have irritation, right? That sounds like a gastritis, which just means gut tissues inflamed. Itis means inflammation. Gastro means gut, stomach. And then maybe we're going to give you Gaviscon to kind of coat that stomach. Maybe we'll recommend Tums or an acid blocker. Maybe we'll give you a steroid. Maybe the next thing is that doesn't work. Then they're going to recommend a scope. Let's say they see an ulcer there. They may test for H. pylori. They may be getting closer, but now they're throwing a whole bunch of antibiotics at it that only work 70% of the time and can create bacterial overgrowth in other areas. And so they may not get to the root underlying issue, and they may just try to symptom spot. And so I always tell patients, how does the diagnosis get to the root cause? Now, if you're bleeding, you have a serious ulcer, you may need something to reduce the inflammation acutely. But in the end, what happens next? Because you still didn't get the root cause addressed. Why did you have that to begin with? What foods were you eating? What kind of imbalances do you have in your gut? What kind of lifestyle problems do you have? So you have to look deeper. If I go to the doctor and I have knee pain, right? All the doctor's going to say is, oh my gosh, you have arthritis in your knee. He literally said the same thing back to you, just in Latin, right? She said you have arthritis, which means joint. Arthro-itis means inflammation of the joint. He literally just said the same thing back to you. You said, hey, doc, my knee hurts. And he just said, of course, you have inflammation of the joint, which you're like, of course, like no crap, right? Now, question is why? They may say, well, your cartilage is wearing thin. We need to put a total knee in there. But how did that happen, right? Should I add in collagen? Is my exercise wrong? What caused that? Hey, should I look at prolotherapy or stem cells, right? There's so many other means of looking at things that may have helped you in between. And now, again, if it's so far gone and you're not willing to make a change in your diet or lose weight, that may be your only option, right? But I always tell patients, you want to know all your options. You want to understand kind of the diagnostic language. A lot of times they're just telling you the same thing back and they're just spot treating symptoms. Sometimes that may be necessary, but most times you're just ignoring the root cause.
Yeah, and we jumped into the nitty gritty quick. So if people got lost in the weeds of how do you know you have a histamine problem, a lot of people don't. So this could be allergies where you're reacting strongly to the outdoor environment. Like when pollen starts blooming and the flowers are coming on the trees, all of a sudden you're reacting, you're getting stuffy, you're getting brain fog. You mentioned dizziness, vertigo, you mentioned the rash on the skin. It could be flushing. You could have a stronger reaction to leftovers. So the longer protein's going to sit, you're going to have more histamine. So if you eat yesterday's burger for lunch and you feel weird after that, that could be a sign. Spices and herbs could aggravate that too. So if
fermented foods.
Yeah.
Do you have a reaction with that? Do you get a lot of brain fog when you have kombucha or sauerkraut?
Mm-hmm. Yeah. Spicy foods like chips, like even if you're doing these avocado oil barbecue chips and all those spices, if you kind of feel weird, woozy after that, alcohol intolerance, if you take a sip and you're already toasted, that's a potential histamine issue.
Yeah.
What else?
Well, you see it with a lot of Asians too, right? Right. Asians typically get that like red glow, and what do they take? They take Pepsid AC, which is an H2 receptor blocker. So a lot of Asians are very sensitive to alcohol, so they intuitively know that's why you see Pepsid AC being consumed typically by Asians because of the alcohol sensitivity, right? And so it's important to know that. Now, anything else you want to add there, Evan?
Native Americans too. They're pretty sensitive to alcohol. I've seen that.
Oh yeah. I mean, you can go back to the hundreds of years ago. That was clear with different hard alcohol caused major problems for sure.
Insomnia, because histamine's a neurotransmitter too, so it can really make you alert. It can make you anxious too. Fatigue, even I've seen histamine issues driving fatigue, but the anxiety, heart palpitations I've seen in more extreme cases, chemical sensitivity, reacting to fragrances. That's a lot of it.
Good. Now, like, what is histamine, guys, right? Histamine is actually made from the amino acid histidine. So histidine is a nutrient. It's an amino acid. Your body will make it. Now, the more you are inflamed, the more the gut bacteria is off, the more you're low in certain nutrients, because certain nutrients actually help you make the DAO enzyme, diamine oxidase, which actually helps you break down histamine, right? Or also the N-methyltransferase, HNMT is another enzyme. But these enzymes are commonly found in kidney tissue, but that will help break it down. Now, SIBO can impact it, copper, vitamin C, B6. These are all nutrients that are needed to help break down histamine by making those enzymes. Now, histamine, right, it can actually make acid in your stomach. So it could actually potentially cause a little bit of reflux. It can cause issues with sleep, memory, cognitive issue, brain fog. Histamine is a vasodilator. Think like if someone punched you in the eye and it gets swollen, there's actually a histamine response. So histamine acutely it's good, right? You bump your elbow, it's opening up the vessel so you can get blood cells there to attack and get the damage down, and then also bring the inflammation out. So histamine acutely is totally fine. It gets a bad rap. It's when you're in a chronic state, that's where it's a problem. Because now it's causing everything to kind of dilate and swell, and you have this chronic kind of bloat and inflammation issue, right? Obviously, chronically, inflammation is typically going to cause blood vessels to narrow, because that's typically what chronic inflammation does. But histamine, the goal is to dilate. So you want to look at it big picture. Now, you have the H1 receptors. These are going to be your smooth muscle cells. H2 are going to cause abdominal and nausea issues, right? So when you take a lot of the H2 blockers like Pepsid AC, that may help with nausea. Your H3 are going to impact sleep and appetite and your central nervous system. And then H4 are going to impact your spleen, your white blood cells, your colon. So again, histamine by itself, it's normal. It's when it's in that chronic inflammatory state that it's a problem.
Well, what's interesting too, this is all involved in blood flow. Kind of a tangent here, but I just think it's interesting. Erectile dysfunction and loss of libido happens often during the H2 receptor agonist. This is like a 75% occurrence. So these people are having sexual issues now where maybe they're getting put on testosterone or something else to try to help the erection issue, but really they're just on a histamine antagonist that's screwing up that pathway. So once again, it's like a side effect of something leads to another issue. So
yeah, that's why we talked about like Pepsid AC is an H2 blocker, right? But also ginger can block Pepsid, can block H2 as well, but it also can have a stimulatory effect on the hydrochloric acid, kind of a little bit contradictory from what Pepsid is. So it's interesting. Yeah.
Well, we ought to wrap this thing up, but I do want people to
anything
have
else?
resources. Well, we've covered the test, the urine, the stool. Get your gut looked at with the gut bugs. If you're on drugs, let's try to find a better solution than being stuck on those. Let's heal up your gut if your gut is leaky or you've got some gastritis going on. Low histamine diet, we covered that. I actually have a low histamine diet guide that I put together, like a PDF. It's free. There's no catch or anything. So I'll put a link on my podcast when we upload this there. There'll be a link in the show notes for that.
Yep. I would say gluten sensitivity, of course, anything processed, gluten, any of those things can increase it. Again, there's certain medications that can also increase it. So if you're chronically ill, you have a lot of health issues, now you start getting into this polypharmacy cycle, guess what? That could also cause histamine problems. So NSAIDs, if you're taking ibuprofen or aspirin every day, could be a problem. If you're on antidepressants, Prozac, Zoloft, right? Think about it. I saw an article like, was it 20% of boys in 5th grade are on antidepressants? That's crazy. Immune modulators, right? The big drug by Abbott, I think, is Humira, right? And they got the patents running up this year. They use that for a lot of, I think, a lot of chronic gut issues, right? A lot of chronic inflammation. Humira is a big one. Embro, Plaquenil. You have other things that help the blood pressure. Propanolol,
yeah, you're right.
Metoprolol, right? Then you have your Allegra, your Zyrtec, and then you have your Tagamet, your Pepsid, your Zantac, all your H2 blockers.
Yeah, this is a crazy list. I was just looking at medications and histamine and how it affects DAO. Yeah, you covered almost all of them. Those immune modulators are huge too, because let's say you have some gut issue. Like we know there's certain bacteria in the gut that can drive things like rheumatoid arthritis. So Proteus, Citrobacter, some of these autoimmune triggering bacteria. So let's say you have that bacterial overgrowth from antibiotics. Now that drives some sort of autoimmune joint issue like RA, and then you get put on an immune modulator like Humira. Now you develop histamine intolerance if you didn't already have it. And then you get put on a mast cell stabilizer like Chromalin or a histamine blocker there. I mean, man, it turns into a mess quick, doesn't it?
Oh my gosh, yeah. Like you mentioned with the Humira, right? You could have RA or some kind of a chronic gut issue, psoriasis, and now you're on this drug, and then that creates more histamine issues, and then you never fix the underlying issue to begin with. Now, in functional medicine world, right, we're going to get to the root cause. There may be some things that we use that are palliative to work on supporting what's happening, right? That could be quercetin, it could be vitamin C, it could be stinging nettle, it could be NAC. It could be ginger, right? We may use some natural, just getting inflammation down will actually reduce histamine. So we may do some of these things if necessary. We may work on the environment stuff. We may say, hey, we're going to get you an Austin Air or an Air Doctor high quality HEPA filter for your home because you're getting too much antigens from the foreign environment that are stimulating histamine, right? And so you got to look at the root. Now, I want to just make sure we round everything up. There could be some tests that you do from your conventional medical doctor. You could do that N-methyltransferase 24-hour urine. You could do a histamine plasma, right? These are some tests, but it's not going to tell you what to do. It may give you a baseline. Hey, my histamine's in the top 10% of the reference range. We're going to do some of these things, come back in a month. Oh, look, it dropped. So it could just kind of give you an indication that you're moving in your right direction. It's not going to tell you what to do because your conventional doc will just say, hey, here's some, right, antihistamine medication, fill in the blank to reduce it. That's not going to fix it. We may do other things, but that at least gives you a baseline or a starting point.
One other question. This really opens up the ability for us to do part 2, part 3 on this. The hormonal connection to histamine question came in. Adam asked, can women's cycles cause issues monthly with histamine? And then he wrote about mast cell. And the answer is yeah, that estrogen will actually stimulate the mast cells. I've looked at a few papers on this before. So estrogen will cause mast cells to release more histamine, and it will actually downregulate DAO. So you see so many women having issues now. I mean, there's so many xenoestrogens and things from the environment. Combine that with plastics and other things affecting estrogen. A lot of these women are estrogen dominant. So then when they have the spike in estrogen throughout the menstrual cycle, for sure, you're going to have a histamine flush.
Yeah. So in general, what happens with histamine, just to kind of echo, histamine can stimulate the ovaries to actually make more estrogen. That creates more estrogen dominance. So think of any of your PMS symptoms: breast tenderness, cramping, mood issues, sleep issues, irritability, back pain. That's going to cause more of those symptoms. Progesterone at the same time does stabilize your mast cells. It does upregulate DAO. So it helps you deal with it better. So you're going to create more estrogen dominance, and that's not going to be good. Anytime you create more inflammation, also too, your progesterone tends to have a very anti-inflammatory effect. And so the more you stimulate your progesterone to be used for your anti-inflammatory cortisol, you tend to increase this estrogen dominance situation.
Yep. All right. Well, let's wrap this up. I know I got to
We'll
run.
hit it.
You got to run here. I think
Awesome.
we did great, but let's do a hormonal histamine one. I think we could unpack that. I think we could do half an hour just on that topic, if not longer.
Yeah, I'll come back here after, guys, to answer some more Q&A stuff. But Evan, great chatting with you all. You guys want to reach out to Evan, evanbrand.com. Sees patients worldwide, get to the root cause. Dr. J, justinhealth.com. Feel free, myself, reach out. Patients worldwide. We're here to support y'all. Take action, 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 action. Think of one thing you can execute on today, guys.
Heck yeah. All right, man. It's a pleasure.
Hey, pleasure is mine. Take care,
All right.
guys.
See you soon.
Bye, y'all.
Peace. Bye-bye.